All right, now we're ready. Go ahead.
Hello, everybody. This is, maybe that was a little too positive beginning. Hello, everybody. More like in the Lyme disease mode. Hello, folks. My name is Seven Song. I'm going to talk about Lyme disease for the next 2 hours or so. And my goal basically in this class is initially, I'm going to cover some basics of Lyme to make sure we're all on board and what I'm talking about when I'm discussing Lyme, and to give a little bit of information. Not too much, there's lots of excellent information out there. Actually, a lot of confabulation of information really out there. And then I'm going to talk about treatments and the herbs I use in the clinic I work with for people who have Lyme disease. So that's the basic overall arching goal of the class. And I'm just going to jump right in. So my name is Seven Song. I'm a Russian Jew, originally from Long Island, New York. That's my accent. I've been living in Ithaca, New York. That's where I am now. Excuse me, and have been here for at least 30 years. Ithaca, New York is definitely my home. I really enjoy it up here. And then just a few more things about me. So I run a school, the Northeast School of Botanical Medicine. If you like sarcastic, cynical herbal medicine, perhaps consider my school. There's many other excellent herb schools, and probably some great ones where you live. All herb schools are having difficulty though with COVID-19. A lot of us are online and just trying to figure out the best way to bring herbal information to folks. I've been practicing, dabbling, interested in herbal medicine in a very big way since about 1981, when I went to my first herb school in Santa Cruz, California. That seems like a cliche, called the Platonic Academy of Herbal Studies, less cliche. And really since then, since about the early 80s, I've really taken a big interest. The thing that was fascinating to me is that herbal medicine became very popular. I mean, it was a little bit popular in the early 80s, and then it just shot up and it continues to grow. Some of that growth is good, and some of that growth I think is quite negative. I think a lot of it could be very capitalistic. Capitalism is mixed, but I think it could be very greedy. Let's put it that way. And it could also be dangerous. I mean, herbal medicine has the second word in it is medicine. And it is a form of medicine. And so when we talk about Lyme disease, or really any disease that's not just self-limiting, it's really important to think like, what do I expect from herbal medicine? What do I expect plants to do in my body to alter my physiology, my mental status, and help my life? So there's a few things in the beginning. If you're interested in seeing my school, it's at sevensong.com. That's the name of the website. Very influential for me in both ways is I've been a part of the Ithaca Free Clinic, and I'm one of the founding members. There were 18 founding members, there were many of us. But that free clinic has been going since 2006, and we've been shut down since mid-March. I still talk to some of the patients. I'm looking forward to that opening. But working in a free clinic that offers free consultations, it's integrated. There are medical doctors, nurse practitioners, acupuncturists. It's a bit one of a kind. I'm pretty free clinic proud, Ithaca Free Clinic proud. And so since working there, I've got to see more people on a regular basis. It's free, the herbs are free. In order to really to watch herbal medicine in people's bodies over a long period of time, right? Because it's easy enough to give somebody an herb, and if they don't come back saying, oh, maybe they're better, but if you see them and they're like, well, I'm not feeling better, then now what do I do? Or if they are feeling better, starting to make mental notes of like, these herbs seem to help more consistently than other herbs. So that's it. I'm also a wildcrafter and botanist. I'm definitely an outdoorsy person. You might have listened to me and Michelle's monologue together. I like to spend a lot of time outside, but not on a computer, with plants, gathering them, making my own medicine. But I get a lot more help as I get older, frankly. So that's the free clinic. Next thing I wanted to mention is a lot of also my information. I've been working at something called the Rainbow Gathering for many years. And it's a large outdoor event. It's tricky, like to describe it, but we can just say it's free. it's wilderness. And in the past, it would have up to 15 or 20,000. These days, well, these days it's closed, but in the past, maybe 3 to 4,000. One of our recent ones was in Wisconsin. So we were in Wisconsin in early July, and I have never pulled so many ticks off people. We're talking about little nymph ticks, right? I got a much better discerning eye for nymph ticks. We'll talk a little bit about the stages of ticks. So I've just done a lot of first aid, and I think that's enough about myself. I wanted to say that the one thing I'm not trying to do by doing these classes is I'm not trying to get people to see me as a herbal clinician, and I'm not trying to sell medicines. The free clinic is closed. We're starting to do telemedicine if you want to work through the free clinic. I do work with people. I work with people for free or for a donation. If you don't have the money, then it's free. But really, I'm not doing this so people, I get a lot of people asking me for consultations. And if I get a lot, it's going to have to be, simmered down because there's a lot of information coming in. Meaning, I'm glad to try to help some people. I'm not sure how many I can, especially in this environment where I'm just working telemed or phone consultations. Next, I'm also don't sell herbs. I don't sell herbs by mail. If you see me at the free clinic in Ithaca, New York, the herbs are free and they will be free. And they still are free. We deliver the herbs to people at this point in our cars. But again, I'm not here to sell herbs. One more thing is people might put in chats and questions. I have a hard time. I go off speech very easily. And so I'm not going to look that often at the questions because otherwise I'll just be in tangent land for hours. And I'm already there. So just so you know, if you have questions, after this at Michelle, who is hosting this and been really kind in helping me with this, after Michelle posts this on YouTube, you can then post it in YouTube in the comments section. I can look at questions there as opposed to sending me emails with your questions about this class. All right. So first I want to start off with why Lyme is so frustrating, right? So this is just a set of things that I've heard over and over again. And lots of you listening to this, this is going to be very clear. So I'm just going to read some of the reasons why Lyme is particularly frustrating. All right, first, so they're not really in any order. The first is people may have had symptoms a really long time, especially if they got the disease in the 70s or 80s when it was barely diagnosed. So a lot of people have had Lyme for many years. It's been misdiagnosed, mistreated. I mean, it's really no fault of the medical world, until for a long time it was just not known that it existed. So now that we know it exists, sometimes it gets checked for, not always, probably less than it should be. But that can be very frustrating to people who coming in who have had health issues for many, many years. I mean, they finally get a test for Lyme, maybe they find it, right? Because the antibodies might not be very clear after all those years. So that could be tricky, but it's frustrating. I want to say, well, I'm just talking about drugs for a minute. I am pro modern medicine. I dislike the system. I dislike the way pharmaceutical companies operate and the conniving and crazy profit driven. But what I'm not here to do also is I'm not here to say only use herbs. Modern medicines save millions of lives every day. So I am glad to work in a clinic with medical people who have the skills and assessment skills to do that. So this is not like an anti-drug class in any way at all. All right, more frustrating things about it. Oh man, so the tests can be inconclusive or false negatives or false positives. So even after years of Lyme being well identified, it's still your serology tests, you're looking for antibodies, your PCR tests, looking for pieces of genetic material. Those things still have lots of false negatives and occasionally false positives. So it's very frustrating. I'll talk a little bit more about that, but I think the tests are one of the biggest frustrations because you think you have it and you get tested and it comes out negative, but clearly the tests have high false negatives by every standard, right? This is not something you have to be a conspiracy person to think about, conspiracy oriented. This is something that's in all the medical literature. All right, more frustrations about Lyme. You could get frustrated with me if you like as well. The symptoms of Lyme and of what are called co-infections, we'll come to this in a little bit, are very similar to many other maladies, many other illnesses. And so you show with headaches and joint pain and fatigue, and it's true that that could be many different illnesses. And so that's frustrating, especially if you never saw a tick on you, you never had a rash. And so you just don't know what to do with that information. Like, what do I have? Do I have Lyme? And I'm just testing negative. Back to testing for that. And the co-infections, many of them also have very similar features as far as symptoms. So you might have something like babesia and a plasmosis, and actually can show up pretty similarly, right? Even though they're different organisms, one's a bacteria, one's a parasite. But still, the reason for that, just a quick description, is our bodies tend to fight pathogens, things that invade us and cause damage, in very similar ways, and we have similar outcomes from those things, and they show up in many different diseases. More frustration, there's lots of conflicting information. So there's conflicting information about the virus itself, there's conflicting information about treatment, and there's conflicting information about herbal treatment. So lots of confliction there. Another frustrating thing is, while there are medications, antibiotics, for the early stage of Lyme, there's very few medications, pharmaceuticals, for later stages, what's called post-dissemination or late dissemination of Lyme. So that's also a problem, right? Because now you have symptoms, but the drugs could be very strong without really dealing with the cause, but that's true in herbs as well. We're just treating the symptoms. The herbs often don't have as many negative side effects, but sometimes aren't strong enough to reduce symptoms. So there's a lot of frustration about what to do if you go into a more chronic Lyme state pharmaceutically. Next, patients are often not taken seriously, people, right? And so you go in and you say you have this and you have Lyme, and depending on your medical practitioner, sometimes you're not, like whatever, or, you get dismissed. And that's incredibly frustrating. That happens for a lot of different illnesses. Many medical doctors and nurses and nurse practitioners are excellent human beings, warm hearts, caring minds, but this definitely happens as well. Our system is terrible, really, is what I'm saying here. Many systems are terrible. Your primary practitioner may not know much about Lyme or the Lyme symptoms, and so you're the one that has to inform them. Lyme specialists, sometimes called Lyme literate doctors, can be very expensive and pretty much always out-of-pocket expense. Unless you have really some premium insurance, that's going to cost you a bunch of money. And so if you don't have a bunch of money, which is like many people, then trying to go to a specialist is out of your budget, as we'll learn about other parts of this as well. And then there's this thing that's changing the most is, until fairly recently, even the CDC, the Center for Disease Control and Prevention, they often said there was no such thing as chronic Lyme, and it kind of exists, but that's changing. They just changed the title of it. So of course chronic Lyme exists. What's happening, why it's caused, is it one suggestion for chronic Lyme disease is that it's an autoimmune. So basically you get the Borrelia, we'll come to this in a minute, you'll get the bacteria, and somehow your body starts to go into an autoimmune state after the bacteria has been killed. So now you don't have antibodies or bacteria for a test, but still your joints hurt, you're fatigued, cognitive dysfunction, standard symptoms for Lyme. All right, here we go. Ready? Next part. I feel like my cheeks are particularly shiny today. It's a little bit scary. So what is Lyme disease? So Lyme is an illness caused by a bacteria called Borrelia burgdorferi, named after somebody, named after probably two people. Borrelia burgdorferi. There are other Borrelia, so it's a bacterium. It disseminates through the body. Like anything that's been able to live in us for a long time, it has developed defenses and ways to infiltrate and get and avoid our immune system from killing it. Every disease that's successful from its point of view has to be able to go past our incredibly developed immune systems and cause the damage that something like Lyme causes. So it's a bacteria. There's other Borrelias, but for here we'll be talking about Burgdorferi. It's mostly transmitted. So this is just Lyme. This is not co-infections. Lyme is primarily transmitted by black-legged ticks. There's an East Coast black-legged tick, Ixodes scapularis. There's a Western black-legged tick, Ixodes pacifica. They also carry other infections, but the Ixodes are the main black-legged ticks. They used to be called deer ticks. The advantage of saying black-legged is their legs are a little blacker, and deer and dog just sound alike, and dog ticks have different diseases. They don't carry Lyme. And so that's, I think, the move towards black-legged ticks, which I think is a great idea because you can see the color of their legs. It's still a little bit difficult to distinguish, especially when they're young. The most common time that Lyme is transmitted is in summer by the nymph stage. Ticks have 3 stages: larval, nymph, and adult. The larval stage does not carry it because the larval stage is hatching from an egg. The larva has to acquire it from an animal host, and then it falls off and it molts, and then it becomes the nymph. Nymph stage is very small. As I said, like in Wisconsin, like people say they're freckle size. I say you can get like 3 of those in a medium-sized freckle. So it can be very small. And also nymph, when they're in the nymph stage, the middle stage, they're often in during the summer months. And so you can get Lyme at any time of the year, depending on where you live and the ticks around you. But the nymphs cause it the most for 2 things. People are very active in the summertime, well, at least here in the Northeast, and they're very small. And so they have the Lyme, they have the Borrelia burgdorferi bacteria in their gut. You don't see them, and so they can stay on you for up to a few days until they fall off. And so there's just a lot of chance of transmission. So one of the big differences with ticks is that they're gonna put their mouth parts into your body, and they're just gonna stay there for days, right? And the reason is, it's just how they're built. So they basically create a little bit of area where blood pools, and then they stick the hylostome, I think, I'm forgetting the name, kind of the straw thing in there. They have little hooks on the side, and then they drink your blood for days. The reason that they do that is so they can molt and go to the next stage. Females drink a lot more because they are also gonna, in the adult stage, because they're gonna produce eggs. So that's a quick overview of Lyme disease. It usually comes on within a couple of, really for a few days to a week or so. Once we get past this, everything gets more tenuous as far as exacting numbers. So what I want to do is quickly go over the 3 stages of Lyme disease. I'm going to try to sum up most of the Lyme stuff in the first half hour, 40 minutes, and then move to herbs. So there are 3 stages of Lyme disease. They're called early localized, early disseminated, and late disseminated. A lot of people would call late disseminated chronic. So early localized is right after you got bit, the bacteria is being transmitted. It's really, frankly, it's not right after you got bit. After the tick has been on you for a while, it now has it in its body because the tick got it from a rodent. And then the tick might have also taken a ride on a deer. Deers don't have it. And then the tick is waiting and questing, lifting on its legs, waiting for a mammal to suck blood from. It doesn't actually have to be a mammal, from an animal to suck blood from. So then it goes on you. Then it puts its hooks in you, it puts its mouth part in you, and it starts to suck. And it takes a while. Nobody's quite sure how long, but it takes a while. If you take a tick and you can take it off very easily, there's a really good chance you're not going to have Lyme from that tick, right? Because there's not enough time for the dissemination, for the movement of the bacteria from the tick gut into your blood, into that hole that it's just made. So the early stage is within the first few days, the first few weeks. It is absolutely the best time to try to stop Lyme dissemination. It's the best. The Lyme hasn't spread throughout your body yet. And if you're gonna do antibiotics, and if you're gonna do herbs, anything really, right then is your best chance. Of course, though, you often don't know how long was the tick on me. And I mean, these things are tiny, right? They could be on you for days and fall off. You've never seen them. So you can get bit and not know it. But as far as like, if you know it, then this is one of the best times to take antibiotics or herbal medicines. And both, as we'll get to. So that's the early stage. I think I'll go over some of the symptoms quickly. So I think it's all kind of quick. I apologize. I'm trying to get through a bunch of information. Hopefully it's understandable. So your early signs are very much like getting a flu, right? So you might have a fever, fatigue, achy joints, and often just a feeling of unwellness, like you're out of sorts. Sore throat, swollen lymph nodes. Really, you've all had these symptoms from different illnesses at different times, right? Because this is the body's reaction to an infection, to an invading pathogen. In this case, a bacteria. So also other symptoms include a headache and stiff neck. Basically, you feel crappy, right? You're tired, you might have a fever, your body hurts, you might have swollen nodes, all the classic flu signs. And so that's the early stage. If you have the herbs, if you have antibiotics, take them, right? At that point, I'll talk about it now. So one thing to consider is if you got bit by a tick, it's good to have, so there's different antibiotics for adults and children. I just have doxycycline around here. There is some casual evidence, meaning some scientific study saying one thing and some saying another, that taking 200 milligrams of doxycycline once in the first 72 hours after getting bit might help. So this is very controversial. I don't actually know how true it is because it's hard to prove prevention. There are some studies that say that all that does is taking the doxycycline in the early, when you first have it, before you know if you have it or not, meaning just once rather than doing it continually, just gets rid of the rash, but actually doesn't stop the bacteria from proliferating. So I'm just gonna tell you from my point of view, so I run an herb school and we go in the woods a lot. And so I always carry doxycycline with me. I have a prescription for it. And I do suggest doing that. If you're nervous though, if you got bit and it's been on you for a while, there's really the thing to do. I'm just telling you this from my point of view right now, is just do the doxycycline, right? The problem is if it happens over and over again, the antibiotics are certainly gonna have an effect on your body. But really the only medical compensation, the only medical treatment that we know of now is either giving a doxycycline, or I'm forgetting the one given for children, at the time. So I'm gonna say this again. When you go to your doctor and you got bit and nobody's sure, they're just gonna recommend antibiotics. Generally the course is between 14 and 21 days. And that's not even clear, that's the best course. Many people like to do at least 21, some people feel 14 is enough. I've looked at lots of literature and it's pretty hard to tell, but that's at that point. I would also start using herbs at that point. Some of the herbs like Oregon grapefruit, and myrrh, but particularly Oregon grapefruit and barberry, plants in the genus Berberis, might actually augment, meaning help, the effects of the antibiotics. So I am suggesting taking herbs with your antibiotics, especially the Oregon grapefruits and barberries. If you're gonna do that, usually I use it in tincture form. You can also use it in glyceride form. And you'd probably be doing something about 1/2 to 1 dropperful. 1/2 to 1 dropperful. When I say a dropperful in this whole class from now on, when I say dropperful, I always mean if the dropper is full. So when I say a dropperful, I don't mean what comes out after you squeeze it. I mean if the dropper is full. I'm gonna just spell it in here. Get rid of this box out of my face. So there's a handout online, and I posted it in the social medias. If you have it, I have in the handout like a material, the plants plus their scientific names, so I don't have to spell that often because I'm not fast at typing. So I would suggest if you have an opportunity to print that handout and use it for here, it would be helpful. So I've never seen any proof that that helps more, but it's a suggestion that I would make for it. There's other herbs you can use too, but Oregon grapefruit is the only one that's actually been tested, not with doxy, unfortunately, but with other antibiotics showing a compounded effect. But if you're going to do just one, I would do the drug, not the herbal medicine. So this is also the time, these early local part of it is when you get the bullseye rash. The numbers are all over the place. It shows up somewhere between like 60 and 80% of the people who have it. Just look at pictures of bullseye rashes. Make sure to look at pictures of different skin colors, because often like on a paler skin, it's just very obvious red. On a darker skin, sometimes a little bit more difficult to see. And so I just want to make sure that we're checking everybody for bullseye rashes. And so the classic bullseye is red in the middle, your skin color on the outside of that, and a red ring around it. What's happening is the bacteria is now multiplying and spreading out. Sometimes the ring in the middle, the clear area, that's the color of your skin, has a bluish tint. Here's what I suggest. There's 1,000 pictures of this online. I would find a reliable source and start to memorize what they look like, remembering that 20 to 30% of people don't get a bullseye rash. So, but the bullseye rash, if you have it, you probably have Lyme, unfortunately. If you have a bullseye rash and you were bit by ticks, Lyme is a really good opportunity. The rash can take days to come on, though, up to a week. So that's some of the information about that. The next stage is what's called early disseminated Lyme. And this is when the Lyme starts to spread out into your body. If you've treated it, I don't know if the treatment's working or not, but this is the point where you still can treat and there's still potential, but it's getting more difficult because the Borrelia bacteria is starting to move more throughout your body, and it's just harder to kill it at this point. Your symptoms are very similar to the earlier one, but they're worse. More joint pain, more swollen lymph glands, more fatigue, more just feeling terrible. Other things start to show up at this point, though, that are that you don't see early, and that one of the main ones is called Bell's palsy. Bell's palsy is a partial facial paralysis, and so the person's face will droop on one side, and they can't really move it. I can't really do it. There's lots of good pictures of it online. I've seen it. Friends have had this. I'm not really sure. Nobody's quite sure actually what causes Bell's palsy, like what happens to those nerves to cause the face drooping. Generally, it does get better, though, on its own. I have one friend, I'll thank Richard Mendelbaum, excellent herbalist and friend, and he got Lyme. And one of the things that he did is he stung himself on his Bell palsy side with nettles to see if he can reinvigorate the nerve endings there. I think it seemed like it helped, but that's another part. But that generally happens in the dissemination, the early dissemination phase of it. As far as herbs at this point, you're going to start to kick up. We'll go with the specific herbs later. You're going to start to kick up your antibacterial herbs. You want to just start pounding your body with large doses, maybe even larger doses than previously, of things like Oregon grapefruit with berberis, myrrh, maybe andrographis. I haven't used much andrographis, but I'm reading more about it. Yarrow. These are some of the plants that are antibacterial, because that's what you do, right? They're bacteria. So your job is one of your goals is to kill those bacteria. We'll cover some others. Boneset is another one. I want to mention now, though, that from the recent evidence in boneset, and it's containing pyrrolizidine alkaloids, that I would keep boneset down to taking it no longer for 2 weeks at a time. I would just stop it after 2 weeks. But if you have any liver health issues, I would suggest not taking boneset at all. Boneset is Eupatorium perfoliatum. It's not comfrey, boneset. This is boneset. It's easy to look up. If you look up boneset in viruses, it'll show up a lot. It's pretty, I'm kind of disappointed. I am disappointed that boneset seems to have these alkaloids. And that's by people that I trust the information from. It's not like an anti-herbal thing. So one of the final parts here, so the late stage disseminated, it's kind of the virus, it's a bacteria. The bacteria is in you, and now symptoms can get really terrible. This is often when I see people who have had it for years. This is what happens when it hasn't been diagnosed or the antibiotics didn't work. You start to have it, And so your symptoms do change. So now you're going to have less flu-like symptoms, and you're going to have more troubling chronic healthcare problems. So I'm going to discuss a few of them. Some herbs can help. They can, so I'm going to go through the symptoms, and then later I'll go through some of the herbs. So some of the worst stuff, I haven't treated a lot of this, are cardiac myopathies, things that actually affect the heart muscle cells and can change electrical signaling. That's a very dangerous problem. An herbalist might be a part of the team, but also you need medical supervision at that point to make sure you're treating that. That's one of the stronger ones. Mostly what I see is going to be long-term cognitive dysfunction. So that's going to range from anxiety to depression, which didn't exist much before, but also commonly the symptoms that fall under the umbrella of brain fog. Brain fog often means having a hard time articulating, having a difficult time finding the words in your head, memory loss, and it's really of varying degrees. So cognitive dysfunction, often people have it affects them pretty dramatically. Well, all of it does. I guess I work with a lot of people that are really concerned. There are some herbs I feel like do help with cognitive dysfunction. We'll cover some of them later, but there'll be things like gotu kola, rosemary, but I'll cover them more in detail with them. I would say slightly different than cognitive dysfunction or affective disorders or mood disorders or just feeling bad. So more in the anxiety and depression realm of cognitive or mental health issues. Vertigo and dizziness happen some of the time. Chronic pain is one of the biggest ones though. Often it's joint pain, but it can be pain felt throughout the body, but often like just stiff, painful joints that looks a lot like arthritis. There's probably similarities. There might be inflammation, but you're probably not going to have RA antibodies. You're probably not going to have rheumatoid arthritis tested positive, but you might have inflammatory proteins that are elevated. But it doesn't always have that. Lyme just causes very painful joints. And then a lot of fatigue. So those are some of the more common symptoms. I'm sure people here have different symptoms that have happened to you, but here's what it comes down to. It really affects the whole body pretty negatively. Tiredness, achiness, anywhere, headaches, severe headaches, can also impair digestive health. And then it often affects us mentally and emotionally as well with depression, anxiety. The problem is always sorting out what's going on, right? And what is Lyme and what is something else. The reason to sort things out is to try to figure out your best treatment options. So moving forward. I just want to say a few words about co-infections. They exist. They come from different ticks, and some of them come from the exodes, the black-legged ticks. I'm just going to say some of their names. You probably have heard them. I'm not talking about treating these. Some of these do have similar treatments, so herbally as well. So you have like anaplasmosis, babesiosis. When you hear that osis, it's just like the bacteria. That's now a disease. So anaplasma is the bacteria. Osis makes it a disease, anaplasmosis. Ehrlichiosis, Powassan virus, tularemia. So I just want to say that these exist. They exist sometimes as a co-infection, and sometimes they exist by themselves. Ticks cause infections. Most of the ones I mentioned are bacteria, but one is a virus and one is a parasite, and so a protozoan. And so ticks just are able, because they're on us for a long time, to give a lot of different diseases into us. So there's that. There's a lot of testing that can happen. There are basically two major forms of testing for Lyme, and they are testing for antibodies and testing for the genetic material itself. Testing for antibodies is usually a two-stage test. The first one is called ELISA, and the second one is called Western blot. The ELISA is less sensitive, but it's less expensive, and so it's often the first choice in the medical world to test with is doing the ELISA test. If that comes out negative, some people will say, okay, you're not positive. I would always suggest getting the second test or just going to the second one, which is called the Western blot test, which is more specific, not nearly perfect, but more specific for Lyme. And because it's more expensive, often it's not suggested first. And then the CDC says if you test negative for both of these, you don't have Lyme. But there's lots of false negatives, and I would say no. I would say maybe you don't have Lyme, and maybe your symptoms are due to something else. But that's the antibody tests that you're looking at. And then the last test is what's called a PCR. That's a very common term these days because your first test for COVID is a PCR test. And so polymerase chain reaction test, PCR, basically it's looking for the genetic material of the thing causing the problem. And so what you basically do is there's lots of great videos on this. You basically, take a blood sample and you amplify it, or you take a swab and then you amplify that and you find that genetic material and find it in your body. At this point in history, the PCR tests look fairly inconclusive, meaning we're not really sure how well they worked for finding Lyme. So they're pretty expensive. All these tests are fairly expensive depending on your insurance and what state you live in. But that's the testing. So you have the ELISA as your first antibody, your Western blot is your second. If any of these are positive, if any of them are positive, especially Western blot, you probably have Lyme. They do have false positives, but the false positives are much less common than the false negatives. And so I'm going to keep going through this. I'm trying to keep to my 640 limit about covering Lyme and then moving into herbs. Lyme is often misdiagnosed. There's a lot of different disorders, including multiple sclerosis, rheumatoid arthritis, fibromyalgia. That's another frustrating part about it. And the tests are not always conclusive, as I've just said. I want to do a little bit on prevention. So I'm hoping this is interesting for folks, and I'll keep going. And we'll hope for people just sitting here waiting. Get to the herbs, Evan Song. I'm moving there. I'm on my way. Glasses on, herbs in front of me. So one of the best things to do is just check yourself. So I have a full-length mirror. I check myself every day, sometimes twice a day. It's kind of annoying. I'm learning I have to do more like neck stretchy. If you do yoga, this is probably much better than I am at doing this. But because I have to check my back, my buttocks. But really, you check yourself. Like if you've walked through grass, if there's anywhere where these ticks, get a full-length mirror. I tried a little while like using another mirror. I just find turning around and looking at my body and doing it every day. I have a sign. I'm gonna take out the negative word, but this is not a coincidence. This sign, I'm gonna take this one. How do I do this? It has a swear word in it because I swear a lot. But I have this sign at my home. So in case I'm about to go to sleep, my bed faces this. In case I'm about to fall asleep and I see that, I'm like, damn, all right, get up and do my check. You got to do it. You got to check yourself every day. That's just how it is historically, currently. All right, next, 3 tools to have on hand. The first, this is a 20 power loop or magnifying glass. And it's just sometimes I'm like, this is for other people's bodies. I don't usually use it on my own. But is that a nymph? Is that just a piece of grass? So you can probably get away with a 10 power loop. 10 power magnifying glasses are $5. If you buy like at a museum or fancy place, they're way expensive. Any 10 power loop will work. Next, so we're going to talk about tick removal, is sharp tweezers. These are okay. They could be a little tighter. So to remove ticks, you basically want to pull them straight out, but not very fast. If you pull them fast, their mouth parts, not really their head, their mouth parts stay in their body. Their mouth parts have hooks. So if you just yank them, right, those hooks stay in, and that little other piece of sucky straw material also stays in there. We're going to come back to that in a minute. So the best way to do it is get as close to the head as possible. You just start pulling on it. The tick will usually, well, not always, will often start to let go. There are parts in the body, like in folded tissue and in hair, it could be really painful and hard to do. But you're going to really, you grab it and you pull and you pull, and eventually sometimes, not always, the tick will start to relax and it'll take the hooks out, however it does that. And then if you look at it and put it down and see if it crawls. If it's moving, it's alive. So that's good for you. It doesn't mean you don't have Lyme, by the way, but it means that you don't have mouth parts in you. At this point, I always kill them. So I try not to kill everything. How I kill them is I put them on a stove burner and turn the flame on. Don't squish them. First, it's hard to squish them in your fingers, but don't squish them in your fingers, right? You don't want any of tick juice on your body. So you can use tweezers. I often just use my fingers and just twist and pull. But there's one more tool, and I found it really helpful on my cat especially, or in hairy places. And these are really cheap. They're just a few bucks. This is a tick removal tool. There's lots of different forms and styles, but basically if the tick was here, you just slide it and start to gently pull it off because it's pronged right there. I have a really small one, and then this one is for larger ticks. And I always have it in my first aid kit. I always have a tick removal tool, because if it gets in your pubes, you're pulling it and you're pulling pubes, and it's unpleasant, right? I think maybe we can get maybe there are people who love having the pubes pulled. I'm not gonna judge. So, but I've had to remove ticks from so many body parts. I'll tell you though, where people freak out, one of the most common places is in their belly buttons. So I've had ticks become like engorged scarabs in their belly, and then it's tricky to get in there. All right, enough with the story 7 song. So check yourself. Have good tweezers. These are only mediocre because they bend a little bit. If these were stiffer, they'd be better, but the pointiness of them is excellent. And then burn your tweezers in between pulling ticks. Clean them by just burning them. Wash this in alcohol after pulling a tick, just any kind of alcohol really, isopropyl, rubbing alcohol. The last one, some people really dislike it, but I will do this, and that's permethrin. So permethrin is a chemical analog to a naturally occurring chemical that happens in chrysanthemum flowers, pyrethrins. So the chemical, though, is definitely synthetic. It's just based on this natural chemical. So permethrins, not pyrethrins, but permethrins, are very strong. Their ticks die on them, and so do a lot of other insects. If you're really nervous about ticks and you live in a tick-infested area and you keep wanting to walk and you get very nervous about getting ticks on you, I suggest doing this. So I've done this. I have a whole handout step by step on how to do this, but you should permethrin your clothing. Definitely your shoes, your socks, and your pants. Occasionally, people have reactions to the permethrin, but the people I work with didn't. It also has no smell when you work with it. You have to use, when it's fresh, you need gloves on. It's definitely toxic to the environment, so you can't just spill it out. It's toxic to cats, and it's toxic to any aquatic life, so you don't pour it back into any place where water is going to go back into it. But I would really suggest it. When I went to that Wisconsin rainbow gathering, I never got a tick. It could be a coincidence, but I wore permethrin clothes the whole time. Shoes, socks, and pants are what I wore. And then I had somebody check my upper torso. But if you see it, the ticks just die on it, and it lasts a few washings. That's it for permethrin. What to do when the mouth parts stay in your body. So the mouth parts, I mean, I've had it many times. I've had mouth parts in my body. And often they say after a few days, they just come out. And it's absolutely not true. I've had mouth parts in different parts of my body itch for weeks, like 3 or 4 weeks. Like that place is just crazy itchy. I don't get much of an infection. It doesn't spread at all. So the mouth parts in your body do not cause Lyme. You could have Lyme, but the mouth parts do not cause Lyme. They cause local irritation, maybe local infection. So The thing to do for that is you can try something like activated charcoal, but usually I just put some propolis tincture on it to make sure it doesn't get infected. So first I said activated charcoal to see if you can draw the mouth parts out. I don't know if it'll work. So I said something and now I'm taking it back, kind of, sorry. Usually I just put propolis tincture because I want to make sure I have a little hole in my body that it doesn't get infected, but generally it's just itchy for weeks or sometimes less. So that's mouth parts in your body. And that, believe it or not, brings us to herbs. So I hopefully you're still present. You can give me a quick chat wave if you're still here, if you're enjoying this. Thank you. It's actually nice. I do, you know, I do this class. Most of my classes are online now. All my classes are online now. And even though like I just see words, it's a weird thing to move into the world where I'm just talking to myself and a picture of Michelle. So I really appreciate you being here. I know that it's going to be online soon and you could have just waited, but you'll still be free. Hey, Kelly, haven't seen you in a while. I really appreciate you being here for this. Michelle does have a great photo. She replaced it though from the one with the garden. For some reason, I was making fun of that one. All right. So first, we're going to go through the categories of treatment, and then we're going to talk about, hey, Abby, and then we're going to talk about some of the herbs that go with the different categories. So I want to describe the category, and then a few herbs in that category. And then I'm going to backtrack a little. I apologize. I'm going to backtrack a little. I want to talk a little bit about how to give herbs, and then we'll go to categories. So something that's really important is patient compliance. So in the clinic that I work in, I saw raised hand, a little Freudian bit there. The clinic that I work in, I'm not sure why I'm talking about the clinic. Sorry. The clinic that I work in, most of the people I see have never used herbal medicine, at least initially. So I have a lot of experience with people who have never used herbs. And so it's just important to check in with them. Will they do the herbs, right? And so you could just ask, like, this doesn't taste good, because none of it tastes good, especially these herbs. These are going to be very distasteful herbs. So before making a prescription or deciding what herbs and giving it to them, find out if they'll take it. Find out if the person will take it in the way that you think is best for them. And if not, then come up with some kind of compromise. So let's say when I cover a formula later and I say, do this formula, do 1 dropper full 3 times a day for a month. And the person's like, I can't do anything. It tastes terrible. I can't take that much of it. I'm like, well, how about half a dropper full 3 times a day? And they're like, maybe. And you're like, how about half a dropper full twice a day? The goal, if they don't take it, like if you just give medicines to people, and they don't take them, they don't take them. They just sit in their cabinet. The person feels guilty having it there, eventually throwing it out. And so it's just better to check in about what preparation you want to give people and just ask them, like, will they take it? One thing very important, just to quickly mention, lots of people don't drink alcohol for lots of reasons. If you're going to give a tincture, let them know that it has alcohol. Don't use the word tincture or say, this is a tincture, it has alcohol. Is that okay? If the person says no, then of course value that opinion and move forward. So that means then you might need to do glycerides or capsules or powders or teas. Most of the plants I'll be talking about are going to be in tincture form because it's just easier for me to describe them that way. But some of these can be converted to glycerides. So generally, when I start with people, I start with not giving people a lot to see if they'll actually take it. That's up to you. I would rather, it's a free clinic, so they're not paying for it, but I don't want to like waste herbs, give a lot when people are not going to take them. And then if they're buying them like from you, then they don't spend a lot. So if they live close by, they can start with a small bottle. And if they feel like, oh, I can get this down, then they can move to like a 4-ounce bottle or an 8-ounce bottle or something like that. When you're making their medicine for them, consider what their specific symptoms are. So a very big caveat here is I'm generally not treating Lyme, I'm treating Lyme symptoms, like the title of the class. Most of the people I'm seeing have Lyme or have symptoms like Lyme that have been undiagnosed as Lyme. So what that means is that I'm going to try to be treating their symptoms, not an idea of symptoms. So if headaches is their worst problem, maybe there's more feverfew or tiny bits of lobelia in their medicine. If joint pain is more the problem, maybe more Japanese knotweed or black birch in their formula. So I'll cover some of these herbs, but again, make sure, like if you're treating Lyme, go for what their symptoms are and spend some time asking them. People will know. I mean, everybody wants everything treated, but often if you say, what's the most important thing to treat now? And then you start working from there. In general, I like to keep formulas a little bit more simple and not have too many herbs in them. Like three to five is the numbers I like to stay within. But if you're making a formula, I would suggest not putting lots of stuff in it. So in other words, if you're making a formula and you have 3 anti-inflammatories, like, do you need 3 anti-inflammatories? Well, 1 anti-inflammatory do, especially in larger amounts. So when you're making a formula. When you're dosaging for people, for many things in Lyme, there's going to be 2 dosages. There's going to be an acute dosage that they're going to take as they have the sensation or problem in their body. And there's the tonic or chronic dose that they're going to take on a regular basis. So for instance, let's say somebody has a lot of skeletal muscle pain, a lot of back pain from Lyme. They might take their skeletal muscle tincture 3 times a day, that's their tonic, but they might also take between 1 and 1 dropper full as needed. So often you want to make 2 dosages for people, an as needed dosage and the chronic dosage for it. Consider other forms. So I'm going to be talking about tinctures a lot. It's just a lazy way of teaching, but I do use a lot of them because they last long. I have lots of classes on why I use tinctures, but they have downsides. The biggest one being if you don't drink alcohol, tinctures are absolutely unacceptable. I would not give anybody a tincture in this situation. I've already mentioned this a little bit, but so far, so this is another cavalier statement, meaning I'm saying it, and I hope it's true, and I think it's true, but it might not be true. So I've treated lots of people who take medications, pharmaceuticals for their Lyme and gave them herbs. So far, I have not seen the herbs mitigate, reduce the effects of the pharmaceuticals. I'm not so sure how often I've seen them increase their value, but I'm not sure how often I've seen them decrease their value. So this is a confirmation bias in the sense of if I gave somebody herbs and it made them feel bad or stopped their pharmaceuticals, they might stop seeing me, and I don't know why they stopped seeing me. I just want to be really upfront and clear here. So this is a dangerous field. How often do herbs interact with drugs? They got to interact with drugs, right? How could substances interact with substances and strong substances interact with other strong substances? So there's questions like, do they increase the amount of time in your body? Do they decrease it? But so far, most of the people I've worked with who are taking drugs for Lyme, especially antibiotics, I've given herbs, and sometimes they felt better, and it seems like there's no decrease in the antibiotics. Many of the people I work with, some of the people, have been on antibiotics for years. That's their choice. I'm going to do what I can to support them in their choices. All right, so categories and some herbs. Herbs, you say. So I'm getting new to glasses. I'm learning how to do the dramatic effect thing. I'm not very good at it. If I had a monocle, though, then I could work that monocle. So what I want to do is cover herbs, their categories, and then I'm going to talk about some formulas. We have about another hour of class for that. So the first are called adjuncts. So what I mean is by an adjunct is an herb, meaning a plant, that increases the availability of other things in their body. It might relax their intestinal wall, it might relax their blood vessels, and allows a better diffusion of the other primary constituents in their body. I often do this, especially with things like joint and connective tissue problems, where it's hard enough to have any action on these because they don't have good blood supplies depending where they are and what they are in the body. So So I often add herbs. The two main herbs that I use for this, well, the main herb that I use to increase the efficiency of other herbs is prickly ash. Prickly ash. So the genus is Xanthoxylum. You can look it up. It starts with a Z. Used to start with an X. And that's my favorite. The next favorite herb is cayenne pepper, just good old cayenne. Chili peppers, I tincture them. They increase bioavailability. And you can do them in small enough amounts where basically the person doesn't feel them. It doesn't hurt. And the last one, which I haven't used much, but other people use very often, are black peppers and long peppers. So we'll just go with black pepper. So black pepper, it's most famous for turmeric. But although the black pepper in particular seems like it could help move herbs from inside the intestinal tract to inside the body. So from the lumen to the tissue. Usually when I put these herbs in formula, they're just like 1/5, 1/4 of the formula. They're a small amount compared to the rest of the formula because their job is really just to relax and move things from the bloodstream or from lumens into tissues. I'm really a big fan of prickly ash these days. So these are just in alphabetical order. The next group of herbs are herbs that are antibacterial. And they kill bacteria. Borrelia is a bacteria. Anaplasma is a bacteria. Ehrlichia is a bacteria. Ehrlichiosis, anaplasmosis are bacteria. And so there's a couple of herbs that help kill bacteria. By far, my favorite, the herb that I use the most, is going to be plants in the genus Berberis. Berberis. And the two main plants in that genus that people use are going to be Oregon graperoots and barberry. Not bayberry, not bileberry, but barberry. There are other allied plants that have berberine in them, like xanthorrhiza, yellow root in the Appalachian Mountains, and gold thread. But basically, plants rich in berberine are one of my primary herbs for them. So it seems contradictory to say that I don't think I can kill the Borrelia bacteria, and yet I'm using antibacterials. And so first, like I said, in the earliest stages, I definitely use them. But sometimes even in the late stages, I use them just hoping that maybe they have some action and able to kill some of the bacteria. So I do use them even in later stages, depending on what else, and especially if the person is already taking antibiotics, then I might take it there hoping to amplify the effects of the antibiotics to kill them. Taking antibiotics for many months and years is a very strong issue. People have different opinions. I'm still learning. Some other herbs that are used, andrographis is very commonly used. I have very little experience. I recently got some, and we'll try it. But it's made famous by Buhner's protocol. I don't follow Stephen Buhner's protocols. I think that Stephen Buhner has some very interesting points and some good information, well thought out. I use different protocols. I think there's just many ways to reach this, but if Stephen Buhner's protocols have helped you, then of course continue to use them. Other antibacterials that I use are Boneset. I talked about Boneset previously. Discontinue use after 2 weeks. I find Boneset a little better for viruses as an antiviral, but I have found some effectiveness in some bacteria. It's not my first choice for Lyme disease, but it's a consideration. Echinacea, I use a fair amount of echinacea. Usually you have to use larger amounts. Echinacea stimulates both adaptive and innate immunity, and really you're trying to get your adaptive immunity, your T and B cells up. So I do use echinacea regularly for anybody with Lyme disease in fairly large doses on a regular basis. Another really excellent antibacterial is myrrh. Myrrh is the genus Commiphora. There's a number of them, but it's the plant that's called myrrh. That one pretty much has to be a tincture because the resins are not soluble in water. But myrrh is a secondary choice, probably after barberry, after Berberis genus, to help kill infection, to help kill bacteria. Again, I'm not really sure how well it does it. If people don't get sick after looking like they get Lyme, and especially if they're taking antibiotics, it's hard to know exactly what did it, but I still continue to give it because there is evidence that it helps. And the last of these is going to be yarrow. Achillea millefolium. Achillea, I think, is it's pretty safe. Actually, not so safe. Don't use, all right, big caveat, this big. Every herb that I'm saying should be checked out before giving it to anybody who's pregnant. I'm going to say it again. Every single herb that I'm saying, you should do some research before giving it to anybody who is pregnant. Some of these herbs could have effects. So pregnant people definitely get Lyme and might want to take herbs. Just do your research on that firsthand. So because yarrow is classically known to be detrimental, to be negative during pregnancy. I'm not really sure of its effect, but my midwife friends don't use it, and so neither do I, of course. But yarrow also has antibacterial effects. It's probably like the third main choice out of the fourth main choice. So I'm going to go through the list and say berberis plants, my favorite, followed by myrrh, followed by echinacea. Well, echinacea just shows up in lots of formulas, and then yarrow. If I had boneset and I felt like that's what I wanted to use, and I would use boneset as well. All right, here we go. Next category. Anti-inflammatories. So inflammation is a common consequence or sequelae of Lyme disease. So I use lots of anti-inflammatories. If there's any pain, anti-inflammatories. So if people have headache pain, stiff joint pain, neck pain, body stiffness, anti-inflammatories are a mainstay here. So I want to cover a couple of anti-inflammatories and then maybe go through some of the ones I use regularly. So by the way, when I read them, they're just in alphabetical order initially, and then I'll go into like, these are some of my favorites most of the time. So the first one is black birch. I use a lot of black birch because it's common around here. Black birch is Betula lenta. And I really like black birch, the inner bark of the plant, as an anti-inflammatory. It's rich in methyl salicylates, the smell of wintergreen. Wintergreen plants have methyl salicylates, and that methyl salicylate is, I think, sometimes a little stronger than just plain salicylates. We'll come to those in a minute. But also it has good compliance. Black birch tastes pretty good if you like wintergreen. Actually, I have one patient who hates wintergreen. So we switched out. But black birch is a good one. You can make it in glyceride or tinctures. You have to take fairly high amounts of it, though. The next one is feverfew. Feverfew is tenacitum parthenium. Tenacitum parthenium. And I like feverfews, especially when the person has arthralgias. Arthralgias are painful joints. Feverfew can have some negative effects. Some people are allergic to the plant, mostly when they're eating it, so you want to be cautious with it. I tend to use it in lower dosages. It's a very pretty flower to grow. But I like fever, again, especially as an anti-inflammatory for arthralgia. So the person has achy joints. I just use that word over and over. You can hear the word arthritis and arthralgia. Arth is joint, A-R-T-H. Turmeric is another option. I haven't found it that helpful for Lyme. I have 1 or 2 patients that really like it, so I put it in the list. But I haven't found it as successful. But maybe I should mix it more with black pepper. The next one is an herb I use a lot as an anti-inflammatory, and that's willow. So willow, it's another plant, inner bark. The main way you can make willow is a tea or a tincture. I think it makes a very weak glycerite. I've tried to do that, but I think salicylates don't come out. Methyl salicylate, like wintergreen smells do, but it's hard to tell because you can't smell them. So these are the anti-inflammatories. I'll go over some formulas if we have enough time for Lyme. Probably, though, would be a combination of, I'm missing my, sorry. So my primary choice, I'll type it in later. My primary choice, forget everything I said, well, include everything I said, and then add this, is licorice. So licorice, I think, is the best internal anti-inflammatory from experience, from literature. So I really like licorice. People who have high blood pressure should avoid licorice. You should read about that, and just there are certain groups of people that should avoid licorice. It has to do with blood pressure, so read more about that. And then you raise your hand. You can do like this, writing your hand. Raise your hand if you hate the flavor of licorice, and no matter how important that medicine was for you, you would not take it if it tasted like licorice. So you can put it in your, the licorice haters could add their licorice hate right now. So, some people, of course, like licorice. But I have patients, and there we are, anything but licorice. Some people, there's no way, like it's just gaggy plant. So there are two people not to give licorice to: those who hate it, and those. So I just ask every patient, do you hate licorice, or do you like licorice? I usually say, do you hate licorice? And then the hater's like, yeah, I hate that stuff. So otherwise, I use licorice, and I use it in a fair amount in the formula. So licorice is my #1 anti-inflammatory for Lyme, my favorite, followed by black birch, followed by willow. Willow, you need large amounts, followed by feverfew. This doesn't mean that I just put one of these in there. Like I might definitely put something like feverfew, better for arthralgias, and black birch in there, which is just a better all-around anti-inflammatory. So those are some of the herbs, the anti-inflammatory herbs. Moving on. The next one, I just want to mention some herbs, but it's pretty serious. Sometimes people get cardiac myopathies. The myocytes, the heart muscle cells, don't function as well and don't carry electrical signaling. This is a very problematic aspect of long-term Lyme, or really just post-dissemination. So I'm going to mention some herbs. I don't really want to go into details, but that person absolutely needs to see medical people. Like this is a very dangerous situation. They might be able to take herbs alongside of their medications. So I'm going to name these herbs, but really very serious. These are just herbs to consider alongside of it. So I'm going to name those herbs with all the caveats I just gave. So they're hawthorn, motherwort, hibiscus. I think all these are pretty profound herbs, by the way. I think that these have, with somebody who doesn't have a cardiac myopathy and other kind of cardiac problems, I think these herbs can all have really strong effects. I'm going to go on. And then with those three herbs, the hawthorn, the motherwort, and the hibiscus, I pretty much always add one of the adjunct herbs. It's either going to be prickly ash or cayenne. If the person actually likes really spicy food, I'll put some cayenne in it because cayenne is good for this, and they might like the flavor better. You can also make cayenne glycerite. You can make cayenne honey. Now all of a sudden you're raising blood sugar a tiny, tiny bit, but those are all options as well. So I add them in there. The next one is if people's connective tissue seems disrupted, so their joints and their legs, their joints, knees, wrists, ankles, feel like the tissue's getting a little bit disrupted. It's not as functional. It might be painful, but actually it feels like it's weaker in general. I like to add herbs that increase connective tissue restoration. They help connective tissue function better after being hurt. I mainly use these after people sprain or strain, but I also sometimes give them to people who just feel like their connective tissue just seems not as functional with Lyme, post-Lyme, with Lyme. There's really just two herbs I use for this, two main herbs, and they're going to be gotu kola, again for connective tissue restoration, and Solomon seal. The gotu kola, I have a lot of experience with. Solomon seal, newer, it looks good. And then again, an adjunct, usually prickly ash or maybe cayenne for those, especially with these tissues, because it's hard to get blood flow to connective tissue. So then I'm going to usually add something like prickly ash or cayenne in there. And I pretty much always use both of them. The next one is a very troubling symptom. All these are troubling symptoms. It just depends which one's troubling for you. Troubling for me is sitting down. I'm going to stand up for a second. Excuse me. You can look at the flowers behind me. The new era of sitting instead of standing and teaching. The next one is about fatigue. Fatigue is very difficult to treat. There are many sources of fatigue. So this is the whole thing, like I'm not saying this like these herbs will cure you. I mean, human health is tricky and precarious. And so at no point am I saying these herbs, like, bam, take these and buy them from me and come see me in my fancy office somewhere. Basically, it can be very difficult. And often with Lyme, you have to be consistent. The patients that have had the best results that I've seen are consistent. They'll easily take it for a month or 2 months. then they start to see it feel better. Now, of course, it could just be the Lyme having less symptoms, but I don't think, after this much time, I think that the herbs actually have a pretty profound effect, but you have to take them for a while. So fatigue, which is very common for many people for many reasons, there are some herbs that I like for it, and you can try them. There's no like answer to fatigue. Many things cause fatigue. Overusing your body causes fatigue. Underusing your body causes fatigue. Mental exertion causes fatigue. Wondering when your kids will eventually be going to school again causes fatigue. There's a lot of fatigue. Stress, in other words, causes fatigue too. Some herbs, though, to consider. The first is ashwagandha. Even though ashwagandha seems to help some people sleep, it also seems to have some kind of, I don't really know, some kind of hormonal effect or overall body effect, very general statement, that helps some people feel less fatigue. So ashwagandha doesn't usually make you feel awake. It just makes you feel less fatigued after taking it after a while. Nice thing about ashwagandha is you can just take it in powder form in capsules or just mix it in fluid and drink it rather than putting it in a liquid like a glyceride, which I don't think works well, or a tincture. So ashwagandha. I also really like chamomile for fatigue. Chamomile seems a little contraindicated, right? Because chamomile is used for relaxing, but a lot of fatigue can come from stress. And so chamomile is a non-sedative stress reducer. And so for many people who have fatigue a lot, often there's worry associated. If you feel like that's a part of it, the excessive worry, then really a plant like chamomile, taken regularly in tincture or glyceride or tea, of course, that could be really helpful for fatigue. Next one is eleuthero ginseng. Eleuthero ginseng and ashwagandha are probably the most famous of these. The first one I said. Eleuthero ginseng is sometimes called Siberian ginseng. It's also really nice to take in powder form. A common powder that I give for people who have fatigue and inflammation is licorice powder, eleuthero ginseng powder, Eleutherococcus senticosus, and ashwagandha powder. So I'm giving a formula. The formula I'm giving is for people who have fatigue, but also have inflammation, and looks like licorice might also be helpful for some kinds of fatigue. It's usually like in the powder form, 2 parts ashwagandha, 2 parts Siberian ginseng, 1 part licorice, mix them all together in the baggie, put a half a teaspoon in a cup, stir it, and drink. So those herbs could be specific for fatigue, but they have to be taken for a while. Those are the main ones. There are herbs I haven't tried very much that I hope I'm going to try. I haven't tried maca for fatigue. Some people have really enjoyed it. Some people don't like maca, but some people don't like every herb that I give people. And also rhodiola. But I got a bunch of maca as a donation recently, so maca is going to be on my list of trying for fatigue soon. But that's it for fatigue. The next one is a little less common, so I want to just list some of the herbs. So it's gut dysfunction. So it could be due to long-term antibiotics or even short-term antibiotics. And some people, Lyme just affects their gut. So it may be diarrhea or constipation, but often it's just more like it just doesn't feel right. Like their digestion feels off, and it might be painful to eat. But it's a kind of a more nebulous form of gut dysfunction. In other words, people have very different ways that their gut seems to not work as well after they get Lyme, whether antibiotics or the Lyme itself. So I want to just name a couple of plants that I feel really useful for general gut malaise. To use a nice old-fashioned term for this that I just made up. Malaise I didn't make up. So these are really great herbs. So you got Lyme, and now you just don't feel like eating, or you get more diarrhea, but it basically you just feel like, oh, my digestive system is just not as good as it used to be. Or you say, welcome to old age. So these are some of the herbs. They include catnip. Catnip is also an amazing glyceride. If you want, catnip comes out great in glycerin. Tip of the hat to Kate Gilday, an amazing herbalist in Utica, New York, for this, well, north of Utica. Chamomile is good. Licorice is a really nice gut restorative. I want to name 3 plants together, and they're licorice, marshmallow, and slippery elm. Licorice, marshmallow, and slippery elm. Those 3 plants are what are called mucilaginous plants. And because when you put them in water, they become syrupy in consistency or honey-like in consistency. And sometimes that consistency, that demulcent consistency, that mucilaginous, that mucus-like consistency, when it comes up against the walls of your intestines, seems to have a positive reaction with the walls, maybe relaxing them or doing some kind of healing function that allows the gut to work better. So I'm putting those 3 together. I don't use that much slippery elm because, like most of the source, I think all the sources now are cultivated, but I mostly use marshmallow root. But you can use any of those: marshmallow root, slippery elm from a reliable, ethical source where it's gathered from, and then licorice, which is pretty much always grown. Other herbs that you might want to consider for the gut are meadowsweet, Filipendula ulmaria, meadowsweet. Meadowsweet's really nice for gut inflammation. Meadowsweet is Filipendula ulmaria, as many meadowsweets. And then peppermint and spearmint. I'm more of a spearmint person, but some people are more of a peppermint person. So they're both similar. The next couple of herbs are helpful for the lymphatic system. They're kind of nebulous in what they do. Some of them, they do very different things. So let me check. We have about 45 minutes of class and a bunch of stuff to cover. So I'm not going to get too specific about the specific plants, but instead I'll talk about whether or not I get specific and use time that way. So these different plants affect the immune system and lymph system differently. So the main one that I give to people is going to be astragalus. Like echinacea, but differently, astragalus can stimulate adaptive immunity. So actually astragalus and echinacea often together can be helpful. So adaptive immunity are those T and B cells, those things that kill things directly, those white blood cells that kill things directly, and also can signal to other cells that this is bad, let's kill it, and also make a memory for the thing. So astragalus can be really helpful. I think astragalus is best as a powder or a tea. I think the tincture of astragalus in an alcohol base, not so good. The starches, those polysaccharides that are astragalus, are just so much better taken out in water. If you wanted to preserve a tea with alcohol, you could do something like that. But I think if you just take it as capsules, as powder or tea, you get a better form of astragalus rather than tincture. Another one is going to be red root. Red root is Ceanothus. I'm going to type this in because it could be misspelled. Ceanothus. I use Ceanothus americanus. But this is, so the reason I'm typing it is because this is not bloodroot, this is red root. But Ceanothus is used for enlarged lymph nodes. It's hard to say actually what it does. I mean, enlarged lymph nodes are because your body's working properly and trying to kill something. I mean, the lymph nodes are getting large as you make more white blood cells to survey the body and to kill organisms that are causing harm. So large lymph nodes, you're not trying to drain your lymph nodes, you're trying to get your immune system up. But sometimes after a while, they stay enlarged, and something like that, where you're trying to help reduce it or get them in better functioning, red root is one option. Ceanothus americanus. Another one in this section would be reishi mushroom. So Ganoderma sugae or Ganoderma lucidum are both helpful. I wonder who, somebody's got to be a really fast typist in getting all of this. It is getting recorded, thanks to Michelle. I use a lot of those as well. Also, I can gather them, so I like things that I can gather, but reishi mushrooms do grow around here. Ganoderma sugae, that kind of reishi mushroom. And also I use that as it seems to increase immune function. Again, adaptive immune function and some innate immune function. Innate immune function is what's like quickly on the spot to try to kill something or to start a body reaction to something. That's innate. And adaptive is your body learning to recognize something, then killing it, and then making a memory of it. So the 3 herbs that I've mentioned that I think are some of the most effective is astragalus, eleuthero, and red root with astragalus and eleuthero. Astragalus I meant instead of eleuthero, take that out and put reishi mushroom in there. Astragalus and reishi, not astragalus and eleuthero. Astragalus and reishi are my favorites, followed by red root. There is use of eleutherococcus. Eleuthero does look like it also increases immune function as well, but I use it less for this situation. The herb I want to use more, but I'm cautious, is poke root. Everybody should be cautious with poke root. But it does look like it might play, but I don't know if it would be helpful in Lyme. But it's an herb that I just acquiring more and more information about. Interesting, as the weather is warming, poke root, Phytolacca americana, is becoming more common upstate New York. But it's just one root is like massive, that plant. But I haven't used poke root yet. I'm not suggesting you use it, but I'm suggesting if you do some research or people mention it to understand this plant better. But I wouldn't put it in the body yet, as more evidence needs to be accumulated about its versatility and its helpfulness for Lyme. All right, how are we doing here? So the next group of herbs, sorry, it's a pretty good chair, but I think I need to get one of those backy things in here if I'm going to sit for a while. The next group of herbs are for cognitive function. This is one of the most common reasons people come to see me. I think it's just because you hear that herbal medicine can help this, right? I mean, herbal medicine can help a lot of things, but somehow certain, herbal medicine gets pigeonholed into certain categories, and this is one of them. And so this is cognitive function. Also, it's not that easy to treat with drugs. So this is, this has to do more with, brain fog, inability to recall, really, but just feeling fuzzier inside, memory dysfunction or trouble with memory. There's really a lot involved, but the basic overall pattern or feeling is my mind is not with it, that I don't feel present as much, I can't remember as much, it takes me a while to bring things up, all of these. So there's a formula that I really like for this. I'm going to cover the herbs, and instead of talking about them individually, I'm going to talk about them in a formula. And so the formula has these herbs. It has gotu kola, again, gotu kola is Centella asiatica. It has ginkgo, which is ginkgo biloba. It's always nice when the common name and the genus are the same, makes life easier to explain. Calamus, which is Acorus calamus, otherwise known as the Jim McDonald herb. Hi, Jim, who's probably not here and will never watch this, but still hi to you, Jim. And rosemary, that plant that is called rosemary. And as we give a hi to Rosemary Gladstar, who'll never see this, who has really helped the American herb world move forward. Really a lot of kudos to Rosemary Gladstar and helping herbal medicine be more popular. Sorry, I'm going off track. Rosemary was one of my first herb teachers in 1983. So the formula is going to be, let me look how I got it here. I should know it, but I change it pretty regularly, actually. All right, I don't really need that. I don't need that. So generally, it's about 4 parts ginkgo, 4 parts gotu kola, 2 parts calamus, 1 part rosemary. So again, 4 parts gotu kola, 4 parts ginkgo, 2 parts calamus, 1 part rosemary. It has to do with the relative strength of each herb. And I would suggest for people to do this, like do a good amount of it, like up to 1 dropper full. Remember, the dropper is absolutely full, or 2 half dropper fulls, 3 times a day. And some people seem to have really improved. Out of a lot of these herbs, this is something that people come back to me sooner and say, I feel my function, my mental health function is a little bit better. Each herb has very different attributes to it, how they do this. They can all be studied individually. One thing I want to point out, though, is gotu kola is really nice in Lyme because it helps with connective tissue repair, and it's a memory, and it helps with cognitive function. So it's a plant that shows up a lot for me for Lyme because of these two different aspects of the plant. So, so the person, you can take it as needed, but it's more of a tonic. Like if the person just feels like I'm really foggy, but really what I would suggest is taking it 3 to 4 times a day, 1/2 to 1 dropper full, depending on tolerance, how much money you have, how much tincture you have, and taking it for a few weeks to get a result, to see if it increases cognitive function. You could try it for other things. It's not specific for Lyme. It's just an overall cognitive function formula. The next is about anxiety and depression. There's really just a lot of herbs, and if I go through this, it's gonna take the rest of the time. So what I wanna do is give 1 or 2 things about each herb I'm gonna mention, which are 18 herbs. Get ready, pen and paper. Get ready to take notes. Instead, I'll just use up time by playing around. So these are the herbs. You might have to listen to this. Actually, I write lots of handouts. So I have a website that has lots of information. If you go to the website and you go to resources and go to handouts and articles, I have a lot of handouts with a lot of this information. My Lyme handout's pretty outdated. The information is good. It just doesn't have a lot of information. Hopefully in the next few weeks, I make a much better Lyme handout based on these notes. The reason I'm saying that is because I'm about to cover a bunch of herbs that are good for anxiety and depression. And I'm going to just say a few words about when I would use each. So the words will be repetitive. There's just an alphabetical order. So the first is anemone, but anemone holds a special place as it's a plant that's better for panic attacks and anxiety attacks than any other plant. Anemone, also sometimes called pulsatilla. The next one is blue vervain. Blue vervain is particularly good for people who have overexcited minds, just overactive minds, hard to relax, thoughts keep swirling and whirling around your brain. And so, it's very hard to listen to other people. I've written a lot about blue vervain. And I recently wrote a whole blog about blue vervain about this. The next one is California poppy. California poppy seems to have very different effects. I've often seen it do very little for people, but some people feel like it's a thing that just brings them down a step or two. So California poppy, Eschscholzia californica, for some people is really helpful. I find though you might have to take larger amounts of California poppy to have this effect, to have this step down effect where you start to feel more relaxed. Cannabis. I think there's lots of information. Tammy Sweet, who's great at many things, is also excellent at talking about cannabis and its use. I actually have much less experience with cannabis. I've just started. I just have recently got some CBD that I'm going to make into medicine and give to people at the clinic. I haven't had access to give it to enough people because of the price, but now I have a bunch and give it to people freely and see how it affects. But many people so there's cannabis, the plant, and there's CBD, the product. And they have very widely differing effects. Cannabis has many different effects, of course, depending on the strains. So I'm going to keep moving on. Next one is chamomile. I think chamomile is underrated as a sleep herb. I think taking it right before going to sleep, especially as a nice warm tea, really good for people. But as a tonic, also just very relaxing and very non-sedative. Kava kava, the next plant on this. Kava kava is a little bit of what's called a disinhibitor. Meaning that kava kava can help people relax by making them less focused on what's going on in their mind. A little bit similar to what alcohol does. So kava kava is like if you want to shut it down a little bit more than what was the other plant? And then California poppy. Kava kava can be helpful. Kava might have some interactions with drugs. There's some evidence that it might. I haven't seen it yet, but it's a pretty strong plant, and I wouldn't be that surprised. But I think often using kava kava by itself, some of my patients really like it to help sleep because it quiets the mind. And if the mind is the thing keeping you awake, it can be helpful. Lavender. I mostly use lavender when people feel anxious and then their stomach hurts. That's my main time. But it's just a good anti-anxiety herb used with other anti-anxiety herbs. I think that lavender, I don't smell, the taste, just kind of a soothing medicine. I think pharmacologically active. So I think not just, well, if something smells and makes you feel something, that's pharmacologically active too. The next one is lemon balm. I tend to use lemon balm more for depressive states rather than anxious states. It seems very safe that way. So lemon balm for depressive states. Mimosa, Albizia julibrissin, mimosa, like the drink. Albizia is the genus. If you just know Albizia, you'll get there. I like just calling the plant Albizia. I like the word. So Albizia is also kind of mood altering, but gentle for both depressive and anxious states. Where Albizia, though, really comes in handy is when something just hurts a lot, like mentally, and it's hard to move past it. And you're just looking for some relaxation, something that, I don't know, just takes the doldrums out a little bit. But it's non-sedative, so you have to take, you can take it as needed, but better to take it over time. So Albizia is one of the plants that I find useful for both anxiety and depression. And I find it helpful. Well, this is kind of the classic use, not just me finding it helpful. The classic use is when the shine's been taken off of life and you're trying to put the shine on. I'm not really sure how an herb does that, but maybe helping neuron function a little bit. Do that. The next one is oats or oat tops or oat straw. Oats are, yeah, you want to take large amounts of oats in general and take them on a regular basis. And they're best for burnt out syndromes. So you've just been pushing yourself, you have Lyme and you just get fatigued all the time, and you want something that doesn't really sedate you, just something that kind of nourishes your nervous system, then oats. Oatmeal has some function here, as well as milky oat top tincture. And I just made some glycerite, so I'll play with that as well. I missed one, motherwort. Motherwort is really helpful for relaxing the mind. I'm really spending too much time on this. Motherwort is really, sorry. Motherwort is really helpful for anxious, when people are anxious and feel like their heart is racing, whether it's racing or not. Passion flower, next one, really good for overactive minds again. Rose, just really relaxing. Many people like to smell and taste, but I put rose in a lot of formulas because the flavor of, for many people, is positive, not everybody. But also I think it has pharmacological anti-anxiety effects. St. John's wort, I tend to use more for people who are depressed. So having more lethargy, a lack of, kind of a lack of anything, lack of motivation. More St. John's wort. I often mix St. John's wort with lemon balm. Tulsi is a really sweet herb. I think, I don't know, it's very likable. I like Ocimum tenuiflorum. There are a number of Tulsis, Ocimum tenuiflorum. But I like Tulsi as just a general relaxing herb for anxiety. Frankly, I think lots of people would benefit from like something like Tulsi and rose on a regular basis. So it's nice. So why am I giving a bunch of herbs for mental health when we're talking about Lyme? Is because many people with Lyme are anxious or depressed, partly due to the Lyme, partly due to just having Lyme, and life has now changed for them in an unhelpful way. And so these herbs can help people feel better, and then deciding which of these herbs for which kind of person by asking what kind of anxiety, what kind of depression, what kind of mood change do you have that we're trying to help with. The last herb is vervain. And vervain is like blue vervain. You can just grow vervain. So anybody who's listening to this from Europe, I've just seen it in the UK. Vervain is like blue vervain, really great for over anxious, the mind just won't shut up. And speaking of not shutting up, I'm going to keep talking for a while. So those are herbs for mental health. I have lots of videos, I think, of me talking about those things. If you want something way more thorough. I'm not sure how helpful it is to go through them this fast. Next is pain relief. So all anti-inflammatories we covered before. Anti-inflammatories are also pain relievers because inflammation creates pain. Now, both of those things are necessary at times, inflammation and pain. But I just want to say that anti-inflammatories are often pain relievers because when you reduce that pressure, you reduce pain. So these are non-anti-inflammatory pain relievers that are helpful for just a wide variety of different kinds of pain. These are more like general pain relievers rather than specific. So first one, I get to say, look at this. A little jealousy, perhaps. This is hops picked today by Cal and Shelby, the people who excellently helped me out here. It is amazing. I would have had hops in here anyway, but I would have wanted to show it off. So hops makes great tinctures and glycerites. You make oils and liniments. So that's hops. Hops is a good general pain reliever. You can use it by itself. But basically, I don't know, you fall down and your body hurts, you wake up and your body hurts. Though, but hops has the disadvantage of that it can be sedative. So hops is a general pain reliever. Really for almost any achy joints, achy neck, crampiness. It's not specific for those, but it has all around reducing pain. Hops, by the way, also has some reducing anxiety because it is sedative. So if you take a lot of hops and you have to be higher functioning, it could be a problem. Let's say a really long road trip and your body hurts from sitting in the car and you're drinking a lot of hops to help with your body hurting your skeletal muscles from hurting. Might not be a good idea. You're not going to probably fall asleep right away, but you might be getting tired more quickly. So, but besides that, hops is one of the better herbs for helping people sleep because it relaxes the mind and it reduces pain. So if Lyme has it where just like walking around or sleeping, it's very different things. If you're having a hard time sleeping, because when you lay down, your body hurts with Lyme, then hops is a really good choice. So I'm a big fan of it. Again, there are many different preparations one could make from hops. The next herb is Jamaican dogwood, Pisidia piscicola. Pisidia piscicola, Jamaican dogwood. And Jamaican dogwood, all these are kind of my favorite herbs. I don't really have not favorite herbs, but Jamaican dogwood, I feel like accentuates the potency of other pain relieving herbs. I feel like adding Jamaican dogwood, and I've been doing this for years, I feel like and see like are happening here. I feel like Jamaican dogwood really increases the efficiency and potency of other pain relieving herbs, whether it's for your back and shoulders, or it's for your crampiness, or just general pain reliever. I find it very safe. Jamaican dogwood, it does not seem sedative at all. So I use Jamaican dogwood in a lot of different formulas. There's often about 2 to 3 parts of the formula are Jamaican dogwood. The difficulty is finding good quality Jamaican dogwood. So Jamaican dogwood for pain, to help other herbs, especially by itself, it's also a pain reliever. The next is skullcap. So we're still on pain relievers. Skullcap is another general pain reliever. Also might help accentuate the uses of other pain relieving herbs, but skullcap is a little bit better as a skeletal muscle relieving pain. So skullcap is a little better for back pain, shoulder pain. I'm stretching out my body while saying this. Skullcap, for some people, is sedative. For some people, is non-sedative. And for some people, does nothing at all. So skullcap has a lot of variability in its effects in people. So you want to be a little bit cautious when first giving it to them. But I've rarely seen a very large sedative effect. But again, skullcap is just good for overall body pain. And the sedation effect is from nothing to somewhat sedative. We'll go up to, let's say, 6 out of 10. The next one is valerian. And valerian is also a very strong pain reliever. I would say herbally, valerian is about the strongest. The problem is about 1 out of 9 people have a negative reaction to valerian where it makes them agitated. So it happens. I mean, 1 out of 9 is not uncommon. So I'm not really sure what the number is, but if I'm in a room of people and I say who has a bad reaction to valerian, often I get so many hands up, and after counting, it's about 1 out of 9. Valerian makes a great glycerite. It's a great tincture. And I think really, if you take enough of it, it's one of the best legal herbal pain relievers. For that reason, it also helps with people sleeping. Valerian is one of the better sleep aids. And for pain in general, it mixes great with hops. So like half valerian, half hops, or 2 parts valerian, 2 parts hops, 1 part Jamaican dogwood. So something like that could be really helpful. overall body, just really just pain. It doesn't actually have to be overall body pain, but not so much for headaches. I'm trying to think when I wouldn't give it. I give it pretty frequently. I give a lot of valerian. I'll be working with people and they fell and they hurt their ankle. I give it to them. They're Lyme and their body hurts a lot. I give it to them. Again, though, valerian for some people is just going to be a nighttime herb because it might also it might have a sedative effect. So the amount that they need to reduce pain might be the amount that causes sedation. And so better to just use it at night when they don't have to be present. Two other herbs that I'm not going to go into details, just mention them, is wild lettuce. And I've written a lot about wild lettuce. I just wrote a blog about it, but that's a pain reliever. And then CBD and cannabis, which I've talking about. I want to just mention one herb that's considered specific for Lyme, but I don't think it's that specific for Lyme. And that is Japanese knotweed, which has gone through more botanical name contortions than any other plant. So currently, Japanese knotweed is Rhinotria japonica, but the common name Japanese knotweed really hasn't changed at all. So Japanese knotweed is considered specific for Lyme. I don't follow that route. I think Japanese knotweed is specific for inflammation. And I do think, again, like feverfew, it's good for arthralgias or painful joints. So I do use a lot of Japanese knotweed as an anti-inflammatory. I should have had this in the anti-inflammatory category. So Japanese knotweed seems very safe, except if you plant it. Japanese knotweed is the only plant that I throw away. I bag up and I don't know any other plant that I don't compost. There's no way any tiny piece of I just don't want it growing here. Someday it might end up here, of course. So just be careful. Even if you gather it and you process it and you have small pieces that you don't use, don't discard them in compost. They can spread. Besides that, Japanese knotweed is a very safe herb, and it is specific for inflammation and arthralgias that are joint pains, and so I use it a lot in Lyme disease. And I have to admit, many people have read about its use, and so there's the placebo value of, oh, I know this plant, which is always good to have in any formula anyway. So a lot of people want Japanese knotweed, and so it's in there, but I think it's useful. I don't use teasel, another popular herb. I haven't seen the benefit of it yet. I also don't have much experience, so I'm not going to talk about teasel because I don't really have experience using teasel in it. I mean, I've read things. It's just hard to figure out. There's a lot of herbs, and to get clinical evidence, you have to use some of the herbs regularly to actually see how much they work, rather than just things that one reads. In other words, I'm a skeptical herbalist. We're on the last category. We're doing pretty good. Then we'll have a few minutes. So the last category are skeletal muscle relaxants. So this has to do with every time you see me do this, move my body around, I'm trying to do is relax my skeletal muscles. So skeletal muscles are voluntary muscles, and the most common ones that don't feel good are the back and the neck and las shoulders, as we say in English. So there are some herbs that are really helpful for relaxing the back, the neck, and the shoulders some of the time. Chronic back pain can be very difficult to treat herbally, medically, surgically, but these herbs sometimes help a lot because Lyme disease definitely can mess up and make people's backs hurt. So you might want to also do this with connective tissue restorers and anti-inflammatories. You mix and match the different categories. But specific for neck, shoulder, and back pain are these herbs. So the first one is black cohosh. So important word, out of all the herbs I've mentioned, black cohosh should definitely not be used in pregnancy. None of the herbs should be used in pregnancy until you know more. But black cohosh in specific, unless a midwife or a knowledgeable person suggests it. Black cohosh affects estrogen in the body besides its skeletal muscle relaxing action, and so it should be cautiously used in pregnancy. Not at all, unless you're working with somebody who's using it for other reasons, a knowledgeable person. But black cohosh is a really good skeletal muscle relaxant. It's just a different action of the same plant. And I'm talking about Actea racemosa. The next herb, it's a little bit less known. I'll type it in, which is pedicularis. So pedicularis is a plant that sometimes they're called louseworts. Sometimes they're called betony, but that gets confused with wood betony. So pedicularis, sometimes called lousewort. They're actually fairly common plants in the Rocky Mountains. There are some eastern ones, but pedicularis is one of my favorite skeletal muscle relaxants. So I go to the Rocky Mountains every few years and gather enough of it to last me a little while. So there are a number of species of pedicularis, but it's just a good, again, skeletal muscle relaxant. And unlike black cohosh, doesn't have any contraindications in pregnancy. So I got a little insect here. So pedicularis is safer for it, and it works almost as good as black cohosh. Black cohosh is a little stronger. And the other advantage of black cohosh for me is that it grows closer to where I live and I'm growing it. But otherwise, I really like pedicularis. Those are my two favorite skeletal muscle relaxants, black cohosh and pedicularis. I often add, as you might guess now, Jamaican dogwood to this mix, because Jamaican dogwood will augment or help these things to be stronger anti-skeletal muscle relaxants. And I often add skullcap as well if I feel like it'll benefit. Skullcap is a little bit better at overall pain and also a bit of a skeletal muscle relaxant. I want to mention a plant that I didn't mention because I don't use it in Lyme, and that's arnica. So arnica is an anti-inflammatory, but I really only use arnica. So I don't use arnica in Lyme. And the reason for it is that it's usually just best used for body injuries like spraining and straining your body or other impact injuries. I feel cautious about using it externally. Well, I don't see much use of it for Lyme disease. So we have about 15 minutes left. I actually got through most of my information. Michelle, you can say congratulations afterwards. But I want to do now is I want to go into some of the formulas that put some of these herbs together into formulas, and then we're pretty good, I think, hopefully. Thank you, Michelle. It's true, I haven't finished yet. All right, so we covered the one for cognitive dysfunction. So that was the gotu-kola, ginkgo, rosemary, and calamus. We've covered the one for connective tissue. That's, again, gotu-kola, Solomon seal, and prickly ash. Let me give some ideas on dosage. For the cognitive dysfunction, I already said about 1 dropper full 3 times a day. For the gotu-kola, ginkgo, calamus, and rosemary, about 1 dropper full 3 times a day is a pretty good amount. That's a pretty good standard dose anyway, frankly. I want to point out, though, that if you actually do that dose, a 1 ounce bottle lasts 5 days, right? So this is a whole other subject that doesn't get discussed. But actually, if you do 1 dropper full is 2 milliliters, you do that 3 times a day, that's 6 milliliters. 1 ounce bottle is 30 milliliters, so it lasts 5 days. It's just, we all have to figure out ways to help people who can't afford herbal medicine get herbal medicine. So I have other classes where I talk about how I work in the free clinic. And a lot of people, my school basically funds my free clinic work, to put it that way. But a lot of times people, you say this and they're like, less than a week later, like, I'm out, what do I do now? And there's a number of things you can do. You can do less amount, less times per day. I talked about an early stage tincture when the person has early Lyme. One tincture to consider for that when they're on antibiotics. I'm always recommending antibiotics here. So early stage, maybe that bull's eye rash. You might want to also give them an herb tincture that contains berberis. Remember, that's like Oregon grapefruit and barberry, 2 parts. Echinacea, 1 part. Myrrh, 1 part. And yarrow, 1 part. I'll say that again. Berberis, barberry, and Oregon grapefruit, 2 parts, and then the rest are 1 part. Echinacea, myrrh, and yarrow. Now, this is hoping that they instigate a reaction and maybe reduce the bacterial load in your body of Borrelia, of the Lyme disease causing bacteria. I would suggest this 1 dropper full 5 times a day. That lasts 3 days, something like that. When you're trying to kill something, you just want to hit it hard and heavy. So of course, if you can't afford that, I would suggest doing something like half a dropper full 5 times a day. In other words, I'm suggesting when you have an active bacterial infection that's still at a stage where you can kill it, to take your herbs on a regular basis. So if you don't have that much, take them instead of a lot once or twice, take smaller amounts regularly, because the herbs don't seem to work as well if you just take a lot at once. It's better to take them to spread them out throughout the day. So that's another one. I have one here that I'm calling, I can't hardly ever call things like this, like an emotional storm tincture. So this is when you have Lyme and your mind is just overreeling, and somehow the disease makes you overthink all the time and you have a very hard time relaxing. Here's one of many possible combinations for that. It would be passion flower, 5 parts, blue vervain, 4 parts, Damiana, I'm sorry, I haven't mentioned Damiana yet, but Damiana, 3 parts, hops, 1 part, kava kava, 1 part. So again, passion flower 5, blue vervain 4, Damiana 3, hops 1, kava 1. And this has like a bit of a sedative effect and a bit of an overall like reducing anxiety effect. It's really nice to take it as a tonic, meaning like 1/2 to 1 dropper full, 3 to 4 times a day, 1/2 to 1 dropper full, 3 to 4 times a day. I'm not sure what I'm doing with my finger. But also 1/2 to 1 dropper full as needed when the mind is way, way too active. So 1/2 to 1 dropper full as needed. So you can take it throughout the day. I mean, at one point you might hit your sedative limit and you're just feeling too tired, and then you have to reduce the amount that you take. I want to give a tincture for fatigue, for general fatigue. And that would include ashwagandha, 2 parts. Excuse me, whoa. Ashwagandha, 2 parts. Eleuthero ginseng, Siberian ginseng, 2 parts. Chamomile, 1 part. Schizandra, a plant I haven't covered, sorry, 1 part. I'll say those again. Ashwagandha, 2 parts. Eleuthero ginseng, 2 parts. Chamomile, 1 part. Schizandra, 1 part. Something else you might want to do is have like, with that, and taking the same amount, have like oat straw tincture on the side, because oats can be helpful for fatigue, especially if it's overactiveness that's causing it. This tincture, I would recommend, I wouldn't take this as needed, I would just take it regularly. So as a tonic, 1/2 to 1 dropper full, 3 to 4 times a day. 1/2 to 1 dropper full, 3 to 4 times a day. The next one, by the way, thanks for staying throughout this class. Everybody who's here, thank you for staying with it. The next one is not Japanese knotweed, is joint pain and inflammation. So this is for joint pain and inflammation. So arthralgias with inflammation, very, very, very common part, because the Borrelia bacteria is a spirochete that gets the muscle tissue in your joints. So that's what happens. So the spirochetes are just able to flagellate, move themselves into muscle tissue. So a lot of joint pain, but they can go into many other, they get disseminated into the heart, to the brain. I mean, they cause a lot of change. So this formula is Japanese knotweed, 3 parts. So again, this is for joint pain and inflammation and arthralgias, painful joints due to Lyme. So Japanese knotweed, 3 parts. Licorice, 2 parts. Avoid licorice if there's high blood pressure or if you just hate it. Feverfew, 1 part. Black birch, 1 part. Willow, 1 part. I'll read that again. Japanese knotweed, 3 parts. Licorice, 2 parts. Take out for high blood pressure. Feverfew, 1 part. Black birch, 1 part. Willow, 1 part. The dosage taken is 1 dropper full, 3 to 4 times regularly. You need a fair amount of it. 1 dropper full, about 3 to 4 times daily. But also just for pain, you can take a 1/2 dropper full as needed. So if you just feel like, oh, I'm stiff and it hurts, 1/2 up to 1 dropper full as often as needed. It's a pretty safe remedy. I think that question's about I don't know any good replacements for licorice. I would just take it out of the formula. And so the last one, I really haven't talked anything about this, but this is if you feel like your nervous system, you want something, you have tingliness or numbness in fingers or hands or toes, and it feels like your nerves are not firing as well due to Lyme disease. You have tingliness or numbness. And I'm not sure how well I've been giving this for people for a little while and still trying to collect results. But this is an herb. These are herbs for basically nervous tissue restoration or nervous tissue aids. They're lion's mane mushroom, Hericium arenaceus, lion's mane mushroom, St. John's wort, Hypericum perforatum, and prickly ash. So I'm hoping this is helpful. The prickly ash is just to help the herb function better. And so we have lion's mane is 3 parts, the mushroom, St. John's wort is 3 parts, and the prickly ash is 1 part. The dosage is 1 dropper full, 3 times a day, at least. You have to take a fair amount of this too. So we have about 4 minutes left. I can actually answer some questions. Before I answer any questions that people might have, can I just please, I just have to say, please vote in November. I know it's not far away, and we're all making changes by going out and trying to make change in the streets and in our homes, but also voting matters, and I just want to be one of those people who pushes people to the polls without saying who to vote for. So maybe flowers are a clue. Does anybody have any questions that I might be able to help with? The lion's mane is a mushroom called Hericium. I don't know if I can spell it, I apologize. Arenaceus with an E. Hericium, which means, I think means hawk, and arenaceus. The part of it would probably be the same amount as St. John's wort, 3 parts. So the last medicine I mentioned was for nerve tonic, and that was lion's mane, 3 parts, St. John's wort, 3 parts, and prickly ash, 1 part. So I'll just start to sum up for folks. We don't have to, is thank you for being here. I think one of the things that we can do as herbalists is just to be supportive. A lot of people who have Lyme have gone through the system, and if they test negative, have just been told that it's in their mind, might be suggested to take antidepressants. And I think, so this is like, I'm going to end on a contentious note. If somebody tests negative for Lyme, and they never had a bullseye rash or never saw a tick, and they have these symptoms, I also don't know if they have Lyme. Like, I have no magical way of knowing that they have Lyme, meaning that you have Lyme. And so if the person, I cannot say you definitely have Lyme, but I can say, and what we can all say is, you have Lyme-like symptoms. And so in this class, hopefully what I did is I gave you a number of herbs to treat the symptoms of Lyme. So whether it's a different bacterial infection, so to me, this is really important because I want to stay transparent in what I know and don't know when I'm talking with people. And I want to be very supportive. So it sounds like this. Somebody will say, I have Lyme, and I'll say, have you been tested? And I can feel that they get agitated. They say, I've been tested, but I've tested negative. And I go, that's fine. Like, I don't need a positive test. I just want to know, have you tested positively? Because if they've tested positively and they clearly have Lyme, then you have one route to go. But if their tests are negative, you have another route to go, which is treating them for the symptoms that we've talked about today. So as always, thank you so much, Michelle, for your help. You're amazing, very helpful. Thank you, everybody else, for being present. And I think that's it. Thank you, one and all, for being here. And the class is now ending. Bye now.